Now, individual businesses, cities, and counties can make their own rules. And so we should note that there are still places that you're going to have to still wear a mask according to statewide rules. Schools, mass transit, healthcare settings, congregate care settings like nursing homes, and child care settings. But I should note, it's not at all clear yet just how much this is going to change here in New York City. As I said, cities and counties and businesses can make their own rules. We could see more of a patchwork of rules and regulations from city to city, business to business. The mayor of New York is still, the mayor's office is still encouraging masking indoors and in crowded places. And of course, proof of vaccination is still required to enter restaurants and fitness centers and gyms and the like. So it's just unclear. We're still seeing a lot of people wearing masks, and we know that the CDC has not yet changed their guidance. They're still requiring masking indoors. So we'll have to see just how quickly things change around here. I took a walk around this entire Union Square, a popular retail destination. Almost every store still had their masking sign up. We'll see how quickly those come down. Brianna?
Yeah, we're in a confusing period, I will say. Athena, thank you for that.
So the White House and CDC are standing firmly by their masking recommendations, but more states are lifting these mandates. Joining us now, CNN correspondent Tom Foreman. Tom, where do things stand nationally and what's changing?
John, just like Sanjay said a little while ago about incomplete data, the truth is when you look around the country right now, it's a little hard to pin down exactly where it's all happening because it's different place to place. But we know that the remaining states that do have indoor mandates are clustered over here in the west, a little down here. Not many, a little more, half dozen, something like that. We look at the ones that are dropping right now, that are changing. New York, Athena just mentioned. Delaware, different schedule for indoors and in schools. Rhode Island, California, Connecticut, Illinois, Massachusetts, New Jersey, Oregon. Several of these are blue states. The notion being that places that were really trying very stringently to control this are now finally saying, we think that we can change. It doesn't have to be the way it was.
So Tom, what's the calculation being made by governors in this?
Well, really, it's a three-pronged calculation here. First of all, there's simply the science of it all. Look at the drop-off that we've had here in new coronavirus cases, and if you look at hospitalizations, you have the same phenomenon. Peaked really high and now is dropping off. That's the science part of it. Second part of it is sheer fatigue, the notion that public officials say we do know the public is simply worn out by this. If we can give them a break, if we can move a different direction, that's good. And the third one is, frankly, John, this wall of resistance to those who simply will not get vaccinated, will not get boosted. They're the ones who are suffering from all of this. And to a degree, I think there's been a lot of states saying, we cannot move these people, we can't change them. There's no reason to keep containing all the people who have done the right thing. We're protecting themselves. They want some release, and now with these new numbers, they can give them, especially with spring just around the corner, more ability to be outdoors and not so pushed together.
So what about the CDC guidance?
Well, that's where it gets tricky. If you look at what the White House and the CDC are saying, it does seem to be in direct contravention to everything else we're hearing. To protect yourself and others from COVID-19, CDC continues to recommend that you wear the most protective masks that can fit well and wear it consistently. So they're still saying, wear masks, be careful, while the states are saying, enough already, we're ready to get closer to normal. This, John, many health and public policy experts will say has been a problem from the beginning. Yes, the science has changed. Yes, it's been difficult, but also this constant conflict of messages where one health official, one public official says one thing, another one says something else. Even people who are trying to comply in the best way, very often we're throwing up their hands saying, I just don't know where we stand. Where we stand now is we're moving out from all the mandates, generally nationwide, but depending on what business you're in, what setting you're in, federal building, state building, private business, you may still be facing some kind of mandates. You just have to look around and sort it out.
All right, Tom Foreman, appreciate it. Great to see you this morning.